recent publications on ablation in general and focusing on the microwave ablation. I'll go through 7 papers, 3 breast case papers, and 4 thyroid papers. The first thyroid paper is about long-term outcome of microwave ablation for benign thyroid nodules over 48 months follow-up. It was published in 2022 August. 148 patients were included. The results were as following. The mean volumes of the 148 nodules were 15.6 plus minus 9.4 cubic centimeters, which reduced to 0.6 plus minus 0.6 cubic centimeter after 48 months after the microwave ablation. The nodule volume reduction rate was 96.9 plus minus 2.5 after the microwave ablation. Only 2 patients had recurrent after the procedure, and there was no significant variation about the thyroid function after microwave ablation. Only 5 patients developed complications. 2 of them had bleeding, and 2 had ear pain and toothache during the procedure, and only 1 patient, unfortunately, had hoarseness of voice after the microwave ablation. And there was no cases of esophageal injury, tracheal injury, infection, skin burst during or even after the microwave ablation. So in conclusion, we come to across that microwave is an effective method for treating benign thyroid nodules, and it's expected to be first-line treatment in the future. The second paper compares ultrasound-guided microwave ablation, laser ablation, and radiofrequency ablation for treatment of elderly patients with benign thyroid nodules. It's a meta-analysis which was published in June 2024. 3,055 patients were included, and in conclusion, all the 3 procedures were markedly reduce the volume of the benign thyroid nodules and can safely be used for benign thyroid nodules. While laser ablation was superior to radiofrequency ablation and microwave ablation in reducing the volume, but unfortunately, it had more complication compared to the other 2 procedures. And there were, for significant complication after radiofrequency ablation was enhanced compared to microwave ablation. So in conclusion, we come to the conclude that microwave ablation in experienced hand is superior to radiofrequency ablation. Another paper compared the efficacy of radiofrequency ablation and microwave ablation for benign thyroid nodules. It's a systematic review and meta-analysis, which was also published in 2024. 2,581 patients were included. I'll just go to the conclusion without reading the data. Both procedures were effective and safe for treating benign thyroid nodule. The complication, regarding complication, there was no significant difference between the 2 methods. Symptoms and cosmetic significantly decreased after each of them, and there was no significant difference. Radiofrequency ablation showed higher volume rate reduction at 12 months follow-up, and it seems to be suitable for less experienced investigators, while for experienced hands, microwave ablation is superior to radiofrequency ablation. Well, let's see if it can be used for cancer. Most of the doctors mentioned it earlier. There's a paper, latest evidence of microwave ablation for papillary thyroid microcarcinoma, comparing it to the surgery. It's a systematic review and meta-analysis. Also, it was published in 2023. 1,567 patients were included. Microwave is considerable reduction in the rate of complication, operative time, post-operative hospital stay, and hospitalization cost was much less than the surgery group. And also, regarding the recurrence rate and risk of lymph node metastasis, it's similar to surgery. So, therefore, it can be an efficient, secure, and cost-effective treatment for low-risk PTMC patients. For the breast, we have 3 papers. The first paper shows the efficacy and safety of microwave ablation for benign breast lesions. It's a systemic review and meta-analysis. was published in 2022. A total of 10 studies were included, a sample size of 1,241 patients and 2,729 benign breast lesions. The patients were, there was a volume reduction rate after 3, 6, and 12 months was 47.4 and 62.1 and 85.8 respectively. After 12 months, the disappearance rate was 53.6 and the efficiency rate was 99. And the rate of excellent cosmesis was 88 and the rate of good cosmesis was 10%. And the complication rate was only 2%. So we conclude that it's a safe, efficient, and a very good choice alternative to surgery for benign breast lesions. None of the other lecturers talked about the use of microwave in granulomatous mastitis, which we have so many cases in our clinic daily, and usually the size of the area involved is large and complex. Some of the patients do not respond to treatment, and they will end up with surgery. And in surgery, you have to do wide local excision, disfiguring the breast. In this study, 234 patients were included. The patients were divided into two groups. A group received only microwave ablation, 91 patients, and surgical group, 143 patients were included. For us lesions, 340 lesions received microwave ablation, and 201 lesion patients underwent surgery. There was a significant difference between the two groups regarding complete remission rate, which is much higher in the microwave ablation. Recurrence rate also was less for the microwave ablation. Operative time, there was a huge difference between the two procedures, and post-operative pain was much less in microwave ablation group compared to surgery. So it can be used as alternative for granulomatous mastitis, the cases that do not respond to treatment. It's a high curative rate and low recurrence rate, and it's minimal invasive, and you have sufficient preservation of the gland and contour of the breast. So for these reasons, the patients are satisfied with the procedure and usually prefer the microwave ablation to surgery. For cancer cases, is radiofrequency ablation better than lumpectomy for margin status in breast cancer? It's a randomized clinical trial which was published in 2019. 40 patients were included, very small sample size. They were divided in two groups. A group received radiofrequency ablation, followed by lumpectomy for to see the margins, and a group only underwent surgery. The surgical excision associated with radiofrequency led to a higher amount of local adverse effect, but more free margins in that group. So in this study, they concluded that it's a less invasive treatment for tumors smaller than 20 millimeter. It could be a good choice, but this needs further investigations on research. And thank you.